Okay, let's review these high yield techniques that will help us get excellent patient satisfaction scores. They are making a great first impression, effective communication, and being able to follow up and have closure before you leave the room or before the visit is over. Okay, let's talk about the first technique and how we make a good first impression. It only takes 7 seconds to make a first impression. And most of the communication we are sending to the patient is nonverbal. So it will be our body language. So it is very important that as soon as we enter the room, we smile. The second thing that is important that we do is that as we approach the patient, just a gentle tap on the shoulder or on the leg if they're laying down. It conveys that you want to care for them and that you can be trusted. And lastly, sit down, especially at eye level. It conveys a message that you are willing to listen and they get a sense that you spend quite a bit of time with them. The second technique is effective communication. So we talked already about body language, making eye contact, sitting down. But the next one is discover the concern, the reason why they came to see you in the first place. So after your HMP or after initially getting more information, ask them, what is it that brought you here today that you are worried about? Discover that concern. The next thing you want to do is blueprint the visit. Patients want to know what you're thinking and what to expect out of the visit. We will explore a little bit further in the next slide. Also, follow up and closure. At the end of the visit or at the end of every encounter, ask them, do you have any questions or concerns? So what does it mean to blueprint the visit? Blueprints tell you where you're going to build a home, how it's going to go, where the bedroom is going to go, where the garage is going to go, etc. We can do the same with a patient visit. First of all, patients like to know what you're thinking. They want to have a general idea what to expect with the visit, so we can give them a very brief summary of what will happen now as far as tests, IV, imaging, swabs, etc., and when you're going to talk to them or see them again. And remember, don't leave the room without saying, do you have any additional questions or concerns? Now, I know what you're thinking. You're going to think that all these techniques will take a lot of time, but actually it only take a few seconds. Let me show you what these techniques would look like on an example interaction. So for a first impression, for example, I can walk in the room and say, hi, while I'm smiling. I'm Dr. Burke. I'm so sorry to meet you like this. And give them a gentle pat on the shoulder. Then I can sit down and say, I want to sit down and get a good history from you. I want to make sure we take good care of you today. I then like to ask them straight out, what is it that brought you here that you are worried about? The patient may say something like, I'm worried that I might have a kidney stone, for example. It helps me up front to know what they want to know because it will sometimes guide my workup. And I want to know what is it that they're worried about so I can find the answer for them. After discovering the concern, I do my physical exam and get additional history, and then I blueprint the visit for them. I may say something like, okay, I think you may have a bladder infection, but some of your symptoms do make me worry or think about a kidney stone. So this is what's going to happen. You're going to give us a urine sample. The nurse is going to come in and put an IV. If you have an infection in the urine, they're going to be hanging some antibiotics. Then our radiology tech is going to be taking you to a CT scan. And then you and I will talk again after that. Do you have any other questions or concerns? So how do these techniques help us to deliver a better patient experience and get better patient satisfaction scores? Well, let's take a look at the types of questions that come in the surveys that the patients receive. You will see them on the right side of the screen under Doctor's Overall Score. The first one is Courtesy of Doctors. If you make a good first impression, you're going to score very high on this first question, and it is because of something called the halo effect. It is essentially a cognitive bias that happens when a person's overall impression about you or about something is based on a single trait. If they think this person is courteous and is friendly, they're also going to see that you're a good doctor and that you care very much. The second question in the survey is, the doctor took time to listen. This one is dealing with effective communication. You sat down and you discovered the concern, right? What is it that brought you here today? The patient will remember that you specifically asked that and that you were listening and your body language said that you were listening. The third question in the survey is the doctor was informative about the treatment. Here's where blueprinting comes into play. You told them what you were thinking, what to expect. Not only that, but you also asked them, do you have any other questions or concerns? Any communication or anything that they were thinking about hopefully will have been resolved by then. The next question is, did the doctor include you in the treatment decisions? Once again, this is a part of the follow-up enclosure. When we're asking them if they had any questions, when we're closing the visits, we're giving the patient an opportunity to understand why we're doing what we're doing and give them the chance to ask if they have any other concerns. The last question on the survey is, the doctor showed concern for your comfort. And once again, we're going back to a first impression. We're relying on the halo effect and our body language. So these techniques will definitely help you get great scores on all of these questions, and they do not take very long.